Next is outpatient medications. This is very similar to inpatient medications. However, you'll see sometimes there are supplies listed in the outpatient pharmacy. So if we want to order an abdominal pad, we can select that and select the size of the pad here. Same medication order menu that we just saw. However, the primary difference is we have to select outpatient metrics for this medication. So we put in, let's say we have our SIG, we have our indication. There are no drop-down options, so we'll select something, no comments for this. We want to give a 30-day supply of these pads. This says dispense pads in multiples of 18 only. So that means essentially this comes in a box of 18. So we can select, let's say we want to give this patient 2 boxes. So we'll select 36, and then we'll also give them refills. Remember, always relevant when we're discharging patients, or certainly just prescribing medications on an outpatient basis, to make sure patients have adequate refills, at least to get them until a relevant follow-up appointment. Or if it's a long-term medication, enough that it's not a hassle for them to keep having to come back. This would be based on your conversation with the patient. If you want the medication just to be mailed, say they have a couple of pads left already, they're in a hurry to get out of here, you can say, we'll just mail them to you, they'll get there shortly. The pharmacist can give you a better idea of how many days exactly that will take, but usually it is pretty quick within a couple of days. Or we can select window, stop by the pharmacy on your way out of the hospital, and you can pick them up at the window when they're ready. Same thing as inpatient, we can select the priority. Most of the time, outpatient medications are going to be routine. There's a patient instruction here, and we can select accept, and that will go in as a new order. And again, we can sign that just as we do for any order. Select sign, and that goes in as a completed order.